So, torn ACL, welcome to the club. My name's Ankita and I'm a physical therapist, and even I felt overwhelmed when I got my diagnosis of a torn ACL. I'm about to go into surgery in a few days, and I wanted to share with you some of the things that people just don't warn you about and the little tips and tricks that have helped me along the way. First, I know you're curious, so let's talk about how this all happened. About a year ago, I was skiing and I had a pretty bad fall and my knee swelled up, but I didn't expect much of it because as a PT, I kind of know some of the signs and I wasn't displaying that instability, a positive anterior drawer, or being able to really just have those classic symptoms. So I knew something had happened because it was a little bit swollen, but didn't think much of it, rehabbed it myself, took a few months off weightlifting, and had no problems. Fast forward, I was doing a broad jump where you jump almost like leapfrog style forward, and I did one, I did two, and on the third one, I just felt my knee blow out, and I just knew in that moment that something bad had happened. I had a friend do an anterior drawer test on me, which is your classic ACL test, and it was super positive. And later got an MRI that confirmed that. It's crazy because it wasn't something that was like I was doing backflips on a trampoline off or skiing off the side of a cliff. It was really just a simple jump, and that was enough to just tear that ACL. Because think about this tiny little ligament that's responsible for your shin bone and your femur staying in alignment and not shearing or twisting. I also wish someone just sat me down and told me that this surgery is not a big deal. It's an hour and a half. They do a ton of these all the time. However, what you want to be prepared for is the fact that the recovery journey takes a long time. Your ACL needs time to re-adhere to the bone and develop that stability for it to perform in sport. In addition, your brain has to be able to fire your quad, which helps fire your knee, which helps with doing the things that you want to be able to do. So give yourself a good amount of grace period for the next 6 months. You will find some of the most simple things that you could do before be really, really challenging. Speaking of surgery, it's worth having a conversation with your surgeon about what kind of graft to get, what is the best options for you versus surgical versus conservative treatments, and just being able to hit your pre-op surgery goals. Second, I'm so glad I work in this field because having pre-op before your surgery is going to set you up for such a strong foundation. A few things that I'm doing at the clinic is making sure I test my max quad strength, being able to make sure my range of motion is good, that I can use those as milestones when I get back to starting to do more things. And it's more patient specific over this random vague guideline that's more one size fits all. So if you have a physical therapist that you can go to before you even get to surgery, that is going to be invaluable to your recovery journey. I have 3 goals before I go into surgery, and this is what I tell all my patients. Number 1 is going to be full knee flexion, which is your heel getting to your butt. Number 2 is going to be full knee extension that is equal to the other side. And number 3 is going to be a quiet, not swollen knee. A knee that's not clicking, locking, popping. Lastly, let's talk about the mindset behind this whole thing. I know when I first found out about my ACL surgery, I was distraught. I just didn't expect that to happen to someone like me, and because I know how much patience you have to have recovering from an ACL, I just knew it was going to change my identity. Yes, it is for the short term, but at that moment, it really felt like all the things that I enjoy doing and how movement is part of my every day, being on my feet for my job or being able to Olympic weightlift for fun, being able to go on a long walk for my mental health, all those things were going to be taken away from me if I chose to do surgery for those few months post-op. Now, it's not the end of the world, but in that moment, it felt like the end of the world because movement is my identity. That's what I talk on here on YouTube about. It's what I teach people to do in my online business and in the clinic. It's how I find my confidence. It's how I relieve my stress. And so when you are going through the process of finding out you have an ACL tear or partial tear, just know it's okay to not be okay. I almost feel like I had to go through the 5 stages of grief for my ACL to get to the place that I'm at now, where I'm really just trying to accept things. And I know that moving forward, this is going to be the best thing for future me. Some things that have helped me along the way with my mindset and not throw a pity party all the time is really being able to factor in the fact that I'm doing this so that I can stay healthy in the future and continue to do the things that I love to do. And then second, focusing on the things that I can do. So I actually made a list of red light activities, yellow light activities, and green light activities. This is something I do pretty commonly for people that are dealing with injury. And so the red light list is things that are a no-go. My yellow list is things that are proceed with caution. And then my green list is things that I'm able to do with no restrictions. So then working on my upper body strength and working on stationary things that don't require that ACL to work harder. I found this really helpful because I could really understand the things that were in my control and also not feel like everything was being taken away from me, which sounds so dramatic, but honestly, that's how I felt when I got that diagnosis. Here are some things to do and keep in mind before your surgery that I wish someone had shared with me. Number 1 is going to be to really have a good in-depth conversation with your ortho surgeon, with your physical therapist, and figure out what kind of graft is best for you. There's 4 different types, and I'm going to link below in the description video some of the resources that helped me, because honestly, there is some nuance to each graft and each one has its pros and cons. So it's worth taking your time before your surgery to find out which graft is best for you. Surgery. Some final thoughts are do your prehab, figure out your graft site. Know there is a whole entire mental game to this, and you are not alone if you are having to deal with an ACL injury yourself. And lucky for you, I am going to be able to take you guys along with me on the journey from surgery to 3 months out, 6 months out, and lifelong after. So I hope this was helpful. Please like, comment, subscribe, and I will see you after surgery in our next video.